Are false positives common in prostate screening guidelines? Imagine going for a routine checkup and hearing your doctor say your prostate test looks suspicious. It can be confusing and stressful, but it's important to understand what that really means. When it comes to prostate cancer screening, false positives are quite common, especially with the most widely used test called the prostate-specific antigen, or PSA test. This test measures the level of PSA in your blood, but an elevated level doesn't always mean cancer. It can be caused by other factors like infections, inflammation, or benign prostate enlargement. Research shows that the false positive rate for PSA testing can be quite high. In some studies, nearly half of the men who tested positive did not actually have prostate cancer when further tests like biopsies were done. In fact, the false positive rate can range from about 15% up to 75% depending on the population and how the screening is conducted. On average, about 6 to 7% of men undergoing PSA screening will receive a false positive result during a single screening round. That means their test suggests a problem when there really isn't one. When a PSA test comes back positive, doctors often recommend a biopsy to confirm if cancer is present. But biopsies are not without risks. They can cause pain, bleeding, infection, and anxiety. Interestingly, only about 1 in 4 men who have a biopsy due to an elevated PSA are actually diagnosed with prostate cancer. This indicates that many biopsies are performed unnecessarily because of false positive results. Certain factors can increase the chance of a false positive PSA test. Older men, especially those over 60, are more likely to have false positives. Urinary infections and alcohol consumption can also raise PSA levels temporarily. On the other hand, some conditions like type 2 diabetes might lower PSA levels, making false positives less likely. The high rate of false positives raises concerns about overdiagnosis and overtreatment. Many prostate cancers found through screening are slow-growing and may never cause symptoms or harm during a man's lifetime. This has led health authorities to recommend more personalized screening decisions. Instead of automatically jumping to treatment, doctors now often suggest active surveillance for low-risk cases, monitoring the cancer closely over time. Because of these limitations, current guidelines emphasize shared decision-making. Men are encouraged to discuss their personal risk factors, preferences, and concerns with their healthcare providers before deciding on screening. This approach helps balance the benefits of early detection with the risks of unnecessary procedures and treatments. In summary, false positives are a common part of prostate cancer screening with PSA tests. They can lead to unnecessary biopsies and anxiety, which is why understanding the limitations of the test is so important. Always consult with a healthcare professional to make informed choices tailored to your individual health. Remember, screening is just one piece of the puzzle, and personalized care is key to managing prostate health effectively.